Good morning, everyone. Welcome to the Workers' Mic right here on 720 WGN, powered by the Midwest Coalition of Labor. My name is Ken Edwards with the Midwest Coalition of Labor. Sitting to my left is Ed Maher with the International Union of Operating Engineers. Good morning, Ed.
Good morning, Ken. How's it going?
It's going great. Guess what I have on?
What do you have on?
My Unite Here shirt.
You'll do anything for a free T-shirt, won't you?
Absolutely.
Unite Here shirt, operating engineer's jacket. Do you buy any clothes, or do you?
Not anymore. Not since this job. It's like everywhere I go, they're like, "Hey, take one of our shirts." Take
I love a free T-shirt.
Oh my God! You know what? I will shout out to Unite Here. The shirts are fantastic.
Yeah.
I've got some union shirts that are really itchy and uncomfortable. This one's great.
It's a nice one. I'll have to check out the brand on that one.
It is. I don't know what it is, but Unite Here. Obviously they were on last week, and Karen Kent.
Yep.
Just a fantastic
guest. Yeah.
Just a great labor leader, and it's really great to see that. You don't see a lot of women. Unfortunately, like in the building trades, right? We always talk about like, hey, you should get more women in the building trades, but name a single woman union leader in Chicagoland that is in the building trades. There's not one, right?
Leading unions, I don't believe so.
Yeah,
and I've been coming from a building trade. I can tell you that the effort to bring women into the apprenticeship programs is enormous, and it's breaking new ground, because those are jobs that 30, 40 years ago just were sort of off limits for women. It's not the case anymore, but we're trying to just get the word out that and I think there's a place for everyone.
And it makes sense, and I also think that getting women onto the staff of unions, right?
For sure.
Women business agents, and look what Karen has achieved, and I think it's important, and it should not be such a stodgy old male dominated industry anymore, and I think it is changing.
It is absolutely changing.
Yeah,
it's not the way that a lot of people think that it is.
I think
that's for
right.
sure. But there's certainly more movement that we're trying to make.
So let's start with the biggest
big news this week.
Yep, go ahead.
And that is Friday morning, the United Auto Workers walked out. It's the first time that they've ever gone on a simultaneous strike against all three of the big three automakers.
So explain that. What does that mean?
So they're on strike right now against all three. It's not, the UAW on strike against Ford, but, GM's working. It's all three of them. They're on strike against General Motors, Ford, and then Stellantis, which is the company that owns Dodge, Ram, Jeep, that whole conglomerate. So all the American union auto manufacturers, they're currently on strike since Friday.
Now they're doing something different, though.
Yeah, they haven't shut down every facility. So, like, for example, on day one, they shut down a facility in Michigan, one in Ohio, and I forget where else. But, just kind of spotted around the Midwest.
Yeah.
But they say that it's a new strategy, and that it's going to, I think, frankly, that they're trying to lessen like the financial blow on some of the workers and some of the communities and things like that, while also maximizing the impact on the companies.
Yeah,
because they're really trying to get their message across. This Sean Fain, the head of the UAW,
this guy's fantastic.
He has said
my gosh,
a couple of times, like, we've gone through negotiations. What we're talking about, these are serious, serious things that we need. It's not being taken seriously, so sometimes a strike is just going to happen to get the message across.
And I heard somebody ask him and said, hey, Sean, your strike is going to disrupt the economy, and he came back and said, no, it's not. It's going to disrupt the billionaires.
Well, let me tell you this, and this is something that on WGN, I talked a little bit about this with Lisa Dent earlier in the week, and she had some listeners who texted in afterward and said, oh, unions are driving inflation and all this kind of stuff. Let me tell you this. The cost of an American-made car has gone up around 30% in the last 4 years.
Right.
The wages of the CEOs have gone up around 40% in the last 4 years. Now, supply chain stuff, steel got expensive. Price of cars went up. Steel prices went down. Prices of cars did not go up. There's been massive inflation already without workers getting anything. So the idea that workers are responsible, inflation's been running rampant. Workers haven't gotten anything out of this.
And by the way, like you said, the price of steel went down. It's called greedflation, corporate inflation. I don't care what you call it. The prices are, in my humble opinion, artificially inflated so corporations can make more money, so these corporate CEOs can make more money. 8 people, Ed, own the wealth of 3.9 billion people. 8 people own the wealth of 3.9 billion people. That is just sick.
Well, the average UAW auto worker at any point in their careers, making $28 an hour. So the idea that these folks are greedy, or that they're
making $100 an hour to put a bolt in every 10 minutes. Like, no, they're not. They're making $28 an hour.
Right, and they're out there.
And look at what Karen said last week. Her hotel workers now are starting in 25.
Right.
So come on. Like let's and you know
These are
they're fighting-
American manufacturing jobs. If you're trying to fight against these workers and push their wages down, you're fighting against American jobs. American manufacturing is supposed to be coming back, so let's help it.
Yeah, shame on you.
There it is.
Shame on you, Big Three.
There's
all
your
right?
weekly shame on
Yeah,
you.
go settle this thing.
Yeah, we've got a big guest coming in today that we're very excited to have, and that's Stu Clark,
From Premise Health,
the CEO of Premise Health.
who's just breaking new ground, and they're just killing it. And we'll talk about their
Some exciting
relationship
news.
with the MCL and the unions and whatnot. So we will be right back with more of the Workers' Mic right here on 720 WGN.
All right, welcome back, everybody, to the Workers' Mic right here on 720 WGN. I'm Ed Maher here with Ken Edwards, and we have a very special guest today, and that is Stu Clark, the CEO of Premise Health. Welcome to the show, Stu.
Welcome, Stu. That's super cool that you were took the time to come up here.
Thanks, guys.
Yeah,
Glad
we're-
to be here.
Yeah, we're psyched to have you. You were here, not here, but you were on the phone with us when we very first started this show about a year ago, and you haven't been back since. So a lot has happened in a year, Stu.
Indeed it has.
And
Ken.
we have some big news. So we'll just start with our big news. All right, what do we got going on this weekend? This coming weekend.
We have a grand opening of the first MCL Wellness Center up in Northbrook.
Oh my gosh, that's awesome!
It's the first of 5.
First of 5. That's unbelievable. So, explain what's the health center? Who's in it? Let's big picture for a second.
Right now, the operators and the carpenters.
Okay.
We are hopeful that we'll get some more unions to join.
Yep.
But obviously, a lot of demand for access to healthcare.
That's awesome. And so I know, obviously, in the background, we've been working on this, Stu, since pre-COVID times, right? I mean, literally, for years it has taken to get this and get it right. We could have rushed and opened up garbage, to be blunt with you, but we didn't. And we sat and we nailed it and just got it right. And really, Premise has been a fantastic partner to work with, so we appreciate that, Stu. When is the grand opening?
That's the 23rd, Saturday the 23rd.
So this coming Saturday in Northbrook, right? Do you have the address, Ed?
Yeah, it's up at 4179 Dundee Road in Northbrook.
And what time does it start?
It's about 9 o'clock, and it goes till about 11:30. They'll be doing tours, and this is, again, for members and families of the Operating Engineers Local 150 or the Mid-American Carpenters Regional Council.
Or if you're a union member and just want to see what one of these clinics look like, feel free to stop by.
Yeah, take pictures, send them to your union president.
Absolutely. So let's talk. This is the first one that we're opening together, and the reason this is a big deal for those of you listening is this. A lot of unions, Stu, have opened their own health centers now around the country, right?
It is increasingly popular, yes.
And some have shared, I'm not saying that we invented this model, but on such a large scale with such large unions, and talk about numbers and like literally our 5 will touch hundreds of thousands of lives. And then if more jump on, you get into the millions. These health centers enable us, and correct me if I'm wrong, to bring care to where our members live, right?
That's correct. And Ken, part of the process that takes so long is determining where is the best place to place these.
Yeah.
We have to take these centers to where these working families live.
So let's so we have Northbrook, right? And that makes perfect sense. We do these kind of heat maps and see where our members live, and we try and get a radius and that kind of stuff. But talk about one of our health centers that's going to open up in Utica, Illinois.
Yeah.
Right? Utica. How much is it? 90 miles away from Chicago, right?
Right, down out by Starved Rock.
That's exactly right. Talk about that one.
You have to go where the customer is,
Yep.
and there's density up there. We know that there is a lack of access to healthcare.
Why do you say that?
Well, I think we've got some health systems pulling out of there, a hospital or two closing.
That's right. One of the community hospitals closed. So we have a lot of members, Local 150 does, out in Utica, and we have a hall there where the health center will be located. And folks who live out there are having to drive a very long way if they want to go to a hospital or an ER. It's like a healthcare desert at the moment. So this is something that's very exciting for them.
Carpenters are joining that one as well with us, correct?
Yeah, that's right. And again, all the reasons you all just mentioned is why we're insistent on a physician-led model. when we have a physician-led team,
Yes.
a doctor leading that team, that gives us the ability to deliver a much broader and deeper scope of care to those members and their families.
Let's talk about that. You say physician-led model. All right. So as compared to what?
Well, there are models that are led by a nurse practitioner. There are some models that are led by a registered nurse. These are providers, certainly, but their scope is limited compared to what a physician can do. And so we know that the needs of those communities and those union families, we think that a physician-led practice is serving them best.
That makes sense to me. So some unions opt to go with a, I would hate, I don't mean to denigrate anything, but like a minute clinic, right? That has a nurse practitioner or a registered nurse, but no doctor.
That's correct. Our scope is very focused on making sure we can deliver a comprehensive set of services. There is demand and there is need by these families, and as you all mentioned, healthcare desert. I like that term. Yep. You have to solve that with a comprehensive approach, and I don't know how to do that without doing it without a physician-led team.
And it's not only a physician, right? But you're talking about health centers that have a physical therapist, behavioral health, right, Ed? I mean, that's a big one for us.
Counselors, chiropractic care.
Chiropractic care. I was down at the one that Premise opened with IBW Local 134, and I mean, you want to talk about impressive. Ed, they have an eyeglass store in the clinic. Really? An actual eyeglass, not only just an optometrist, but an eyeglass store. So you can go in there and get glasses. I mean, that's just amazing, right? And I think Premise, I'm going to put words in your mouth, Stu, okay? Because I'm going to act as the CEO of Premise for a quick second. We go big or go home, right?
Yeah.
I mean, that's it, right? Premise is going big.
You all mentioned a really important topic here, and that is mental health. Yeah. And we have a mental health crisis in this country.
Boy, do we ever.
Every family has an issue going on which affects their ability to work, and Premise takes the solid position, if you're going to deliver primary care, you have to incorporate mental health into that. And the mind and the body have to be treated holistically.
Yep, agreed. And we actually had one of the providers on from Premise, it was probably a couple months ago, that talked about it. But as I go around the Midwest, Stu, and talk to other unions and about joining the MCL, one of the common themes I hear is, hey, can you guys help with members assistance programs, EAPs, mental health? And, I'll give you an example. One of the unions in Ohio wanted to start their own. And I think it's brilliant, right? So we started, I was fascinated, kind of got it off the ground. And I know I'm moving to the side for a second. But they realized how important mental health was. Drug addiction issues, right? Depression, anxiety. And that was causing problems for the members in the workplace, then causing them not to work. Their families are hurting. So exactly what you just described, Stu. I think the Premise model, and what happens is you can go to the doctor, right? And the doctor says, hey, I think you might benefit from walking down the hall.
Right.
And go see, Dr. So-and-so. Right, Stu?
Yeah, absolutely. A coordinated handoff, and we expect our physicians and clinical teams to advocate for that member. So it's not just drug addiction and anxiety and depression. Those are real, and those are real issues with our families in this country. But we also know that for diabetics, obesity, hypertension, if you have a diagnosed mental health condition, you're less likely to get better, and your claims are likely to be much more expensive.
Interesting.
So whether you look at the human or the cost, you have to address this mental health issue as part of the primary care model.
So the way that you approach everything that you do isn't a matter of let's get you in, let's run a bunch of tests, we'll collect whatever the patient would pay for that, like a traditional hospital. But it's more trying to get the patient healthy, keep them healthy. Because it's a good investment and it's money well spent by the unions or by all of your other clients.
Exactly. I mean, the system is set up to bill based on volume. Right. There is almost no accountability for cost or clinical outcome.
When you say the system, you mean the current healthcare system in the United States?
I'm talking about Healthcare Inc. in this country. Right. And so Premise was founded with the thesis that if you have a direct relationship, in this case with the union, and you're not paid on volume, then you spend as much time with that member or that member's family member as you need. And for example, when you call to book an appointment, you're going to get a 30-minute slot. right out of the gate. Try to do that in the community with a hospital-owned doc.
Right. Any listeners out there, have you ever gone to the doctor and it seems like they're in a hurry to get out of there? I think everyone can relate to that.
Well, especially when they're talking to you.
Well, yeah, I mean, that's not just doctors, Ken. That's
pretty much everybody.
Waiters, everyone.
I always thought it was my breath. That's what my wife tells me.
That's her too, right?
Yeah.
So go back to this. You called it, I think, once, Ed or Stu, doorknob medicine. Right? Their hands on the doorknob. And was it you that came up with that, Stu?
Yeah. I wish I had invented it. It's been around for a couple of years, but yeah, it makes sense,
So
right?
you go to the doctor, right? And the first thing that happens is they come in, and the doctor doesn't come in. I don't even know if it's a nurse or somebody comes in and they take your blood pressure and check your weight, and then maybe a nurse practitioner comes in and says, okay, what are you here for today, et cetera, and goes over your meds, and is all your information still accurate, and a bunch of, like, I hate to say it, but kind of, I don't know, in my humble opinion, relatively waste of time, because I'm really here for this. And, you want to take my blood pressure and you talk about, like, whether my address is correct and my current, whatever. And then the doc comes in and he sees you for 5 seconds. Oh, I understand that you have this. Yeah. I want to ask you, I got to go. But here, you should take this. And gives you a prescript, and, out the door you go. And at Premise and our health centers, and I've had experience there. Ed, you've had experience there.
Yep.
Tons of our members listening have had experience. You walk in, and they'll sit with you as long as you need, right? And that's exactly what you described, Stu. There's no, you're making what you're making at Premise, right? It's not fee for service.
We make the same whether we see one member or 100 in a day, because we are ultimately measured by the union on, did we make their membership and families healthier, and are we helping them take the efficiency out of the spend?
Right. And so, what's been your experience? Is it working?
Well, we've been in business 30 years now. We've got lots of data. In fact, we've got some news out where Milliman, a third-party actuarial firm, confirmed and validated the way that we measure clinical and financial outcomes. And so we're the only one in the industry that actually has longitudinal data verified by a third-party actuary. It works, absolutely.
We had some numbers at Local 150 that showed the compliance of our members who had been to one of our Premise clinics versus those who had not within the past 12 months, and how compliant they were with early screenings. In particular, the example they used was prostate cancer. And people who had been to a Premise facility had been screened for early prostate cancer far more than those who hadn't. And then they showed the outcomes for if you catch prostate cancer early versus late stage. And it really shows that doing this whole model of participating in the screenings, looking for things that you aren't having symptoms of yet, keeps people healthy and, frankly, keeps people alive.
Yep, that's exactly right, Ed. Once a month, I look at a giant dashboard produced by our clinical team that shows across 6 or 7 different conditions what is the percentage compliance by our providers with their member population. And so it's color-coded. If we drop below 80, it turns yellow.
Right.
As we get above it, obviously it's green. But there are guardrails and incentives and penalties in place if we do not practice what's called evidence-based medicine every single time. The dashboard lights up, and we intervene with that team to say, hey, why aren't we doing diabetes screen? Why aren't we doing prostate screen?
And how does your model compare to, let's say, just American healthcare in general? Like, are we seeing better results in these health centers and your Premise, on-site clinics and near-site clinics and things like that?
Absolutely. Ken, what I'd say, this is what I often tell folks. If there was a 75% chance your milk was going to be pasteurized by the grocery store around the corner, you would go to another grocery store. Yet in this country, we are perfectly satisfied if our family doctor, if our specialist is only 75% compliant with what are known as evidence-based guidelines. That's acceptable to us. In fact, most of the American population doesn't even know how their quality is measured.
Yeah, right.
Because there's no accountability in the healthcare system.
Yeah, we're in the dark. Listen, we got to take a quick break. Will you stick around for the next segment? Because I have some more questions that I want to ask you and talk to you about.
Sounds great.
Listen, we are talking to Stu Clark. He is the CEO of Premise Health, one of our fantastic sponsors. We will be right back with more of the Workers' Mic right here on 720 WGN. Welcome back, everyone, to the Workers' Mic right here on 720 WGN. My name is Ken. Sitting next to me, as always, is Ed. And we're super psyched that Stu decided to stay around. So Stu Clark, the CEO, the head of Premise Health. And by the way, how big is Premise Health? Like, how many employees you got, and where are you from, and all that kind of stuff?
We have 6,000 team members.
Wow.
We're headquartered in Nashville, Tennessee.
I like how you call them team members. Very Starbucks of you.
We are
Partners.
We are absolutely
Actually,
a
no,
team first culture.
I've dealt with a ton of your team, and I really honestly will say they're a pleasure to deal with.
Absolutely.
Like they're
Thank you.
legitimately really, really good people. The person, Tammy, who runs point on what we've been accomplishing here in the Midwest with the MCL, she'll answer your phone calls, she'll take your text, she'll talk to you at night on the weekends. You know, you guys are set up, and I meant to kind of say this in the earlier section. You're set up almost like a union, right? You're not based on fees. Like, when I worked for 150, it didn't matter whether I had 100 guys or 1,000 guys, right? My salary was the same. It was just a matter of how much time and effort I was going to put into it and how much hours I put into it, et cetera, et cetera. But I would talk to every single guy as if he was my father, my brother, you know, and I consider them brothers. You guys treat us the same way.
Ken, I'll tell you, many of us have been in this business working together literally for 20 years.
Yeah.
So there are folks on the leadership team that have been together a quarter century. Most of the leadership in the company started in the clinics years ago.
Yeah.
So we are a family. We want you for life when you join Premise. We have a very strong ethos, and it works for most people, doesn't work for some. But, you know, we're the company that was there 20 years ago. We're going to be here 20 years from now. And people...
What are you seeing out there? Like you said that you've been around 20 years. And by the way, Premise is owned by who? Who owns Premise?
We are owned by OMERS. That is the Ontario Municipal Employee Retirement System. So retired union pensioners own this company.
Wow. So literally union members have a stake in your company.
They are the controlling owner.
I love it. That's awesome. So that's a cool fact. And what are you seeing in this world, right? So by the way, I have to say this because I don't think it's apparent. If you're a union member, and let's say you're in the MCL, and you're a carpenter or an operator at the moment, or the electricians, or any of these places that have their own health centers, which a lot of unions are starting to build or have built already. When you go to the health center, how much does it cost?
Oh, it's free.
Free.
It's free the first and every time.
Right.
Did you say free?
For the unions. Now, we have some customers that do charge, but
Well, that sounds like a them problem.
Most of our union customers have made it free to their membership and families.
I mean, that's just fantastic.
For some of the services, for all of the services,
All of them.
everything. That's
Everything.
amazing.
Yes.
Yeah, you walk and it's free.
So-
and it's in your backyard.
Yeah, so unions are seeing, we're taking these heat maps, as you said,
Right.
Ken, and trying to find where in our geographical areas we have members who are furthest away from medical care and trying to cut that time down. So not only is it a matter of trying to put medical facilities closer to your home and more convenient to your home, but provide you options where you can walk in, get medical care, mental health care, physical therapy, all of these things, and walk out and you never get a bill. There's no copay. This is a great deal for union members.
It is, but there's a just as important other part to this, Ed, and that is our clinical team is going to help that member or that member's family member find the right place to go to in the community if they need a diagnostic, if they need a higher level of care, or need to go to a hospital. This system is set up for people to get lost in it, because when they get lost in it, the entities can bill more.
Right.
That doesn't help the patient, the member, or the family. So our team is going to help them find exactly where they need to go.
And they're going to be involved, because I went through this myself. They're going to be involved every step of the way. Did you see this doctor? Okay, I saw that you saw this doctor. I looked
Right.
at your medical records. Here's some next steps. I get a phone call from our health center, Ed. Like, hey, Ken, you haven't been here in a while. Time to come back in.
Yeah.
Like,
Okay.
Okay. Who's called? Like, what other places are calling you to go? Like, hey, it's time. Or basically that's up to everybody, and everybody blows it off. You mentioned that, or Ed, you mentioned that like we're bringing these things to places that may be underserved, or getting them closer to our members, to where they live. Number one, that's good obviously for the members and their families, right? Number two, it's good for the union coffers, correct? Right? Stu, explain.
Look, higher quality care means that people get better. And higher quality care means that you're not running multiple tests after multiple tests after multiple tests. So if you have a clinical team providing the right care and they are helping that member find the right place in the community, get higher level care, two things happen. They get better faster,
Yep.
and the union saves money.
Right.
It's not any more complicated than that.
It's kind of a win-win situation.
Absolutely.
And, talk about cost-benefit analysis or a value add, right? Here's yet another thing that the unions do. I've talked to other union leaders, and literally I've said, hey, we have a doctor's office or two. They're like, what? You guys have your own doctor's office? I'm like, we do. And, even some of it, just like, people in my neighborhood, like, wait, your union has its own doctor's office? Like, yes. Like, I don't know how else to say it, right? And people are just shocked. And once again, Ed, we're our own best kept secret.
Right.
Right. So we're trying, hey, everybody, join the trades and join a union, and you too can have, your own doctor. But Stu, let's talk about economies of scale for a second, because I think the premise model and the reason that the MCL chose your company was you understood the need for to leverage a union's economies of scale, meaning where we couldn't put one by ourselves, right? Like, so I came from 150, right, where Ed works. We couldn't afford to put one in Grays Lake, for example, of Illinois by ourselves, which for those of you listening all over the world, Grays Lake is a suburb of Illinois, of Chicago, Chicagoland, but, it's not particularly dense, right? But if you overlay us, the carpenters, other unions, well, now you put put all those together, we can afford it, right?
Yeah, sure. And this model is really springing up. We're looking at 3 other MSAs, cities.
What is MSA?
A metropolitan service area. So 3 other large cities where we're looking at doing exactly the same thing, whether it's with unions or whether it's with mid-sized or large employers that are also looking at sharing.
So let's pivot for a second. We talk about unions, but Ed and I have talked about these organizing drives like Starbucks or Amazon or whatever, and sort of saying like, hey, let's disrupt healthcare, right? In your negotiations, ask for a doctor's office, right? You can afford it, Amazon. You can afford it, Starbucks. You can afford it, Stellantis. And
if they really thought about it, it goes beyond affording it. It would save them money.
Of course it would save them money, and it would be altruistic, and they would help people, and they would maintain their staff and have less turnover, right?
I mean, here's what I'm hearing from corporate executives.
Yeah.
That healthcare is so expensive and the rate of increase is so untenable, it is now an earnings per share issue.
Wow.
That gets the attention of the CEO and the CFO.
That's
so
what
it's
it
no
takes.
longer, I'd like to have a health center because it's nice for my employees.
Yeah.
It's the CEO thumping HR saying, we can't afford this and we're going to miss our earnings because of our healthcare costs. So part of what's driving the demand right now for premise, and we've got a great backlog and tons of traction, more than I've ever seen in 30 years, is exactly that. We can, whether we are a union fund or whether you're a large employer, the cost of healthcare is out of control right now, and it is increasing anywhere from 7 to 12% a year.
Right.
Something's got to give.
Hey, Ed.
Yeah.
I have an idea.
Let's hear it.
Ken and Ed's Health Center.
I'm down.
How much money you got?
We're going to need a lot of disclaimers and a very, very healthy
I have
insurance
this
policy.
really good idea. WGN's Health Center. Brought to you by Ken and Ed.
Yeah, but I mean, to your point, the way, and a lot of folks might not know this, but the way that a lot of union healthcare funds are organized is members have an hourly contribution that's paid in on their behalf. And it all goes into, a fund of money. And our plans are self-funded. So if there's a claim for something that has to be paid to a hospital or paid to a doctor, it comes from that fund of money. And so it's in the union's interest to ensure that, if there's a lot of claims going out for really like late stage, cancer treatment and things like that, if you can do a little bit of wellness care on the front end and cut down those numbers, it makes perfect financial sense to do it. And so that's why this model, I think, appeals so much to a self-insured plan like ours. But a corporation, if you have fewer, extremely expensive cases, health incidents, then your coverage costs are going to go down. You can go to your insurer and say, charge us less because our people are not using as much.
It doesn't seem
healthcare.
it doesn't seem like rocket science.
No,
right? If
I can understand it, this can't be that hard.
That's a good point.
I'll just put it this way. Healthcare in this country we spend $4 trillion a year, or 1/5 of the entire domestic output.
Whoa.
And we have one of the most unhealthy populations in the world. So something is very, very wrong with how we're set up. And the bottom line is it's not just preventative care saves money. And yes, that's important for the union. That's important for the members. But here's the thought. You can live healthier longer,
Right.
enjoy your family, and enjoy life more
Wait
so.
a second. It's not
Can you
just all
imagine?
about dollars and cents?
Well, at the end of the day, for the corporate users, it might help your stock price. So,
And it could do that too.
that's they don't care about the rest of it. It's just stock price good.
Well, I'll tell you, I told this story, a few weeks ago, but, Premise Health literally saved my life because they caught something, in my heart that I didn't know, and Premise Health just refused to sign off on something and sent me to a cardiologist, and it literally saved my life. They saved my life. This one woman, nurse practitioner there, saved my life, and that was literally as a result of me going in for something completely different. So I owe my life to Premise Health.
We don't hold that against you either, Stu.
I mean, it makes my hair stand up. But I have to tell you, I hear these stories every single week. You know, we serve millions of people out there across 800 centers, and we like to say we are on the right side of healthcare.
I think you are.
We're not paid by health plans.
Yeah.
We're not paid by the government.
That's right.
We are paid by the unions, and we are paid by the employers. And the population either gets better or they don't. And if they don't get better, we get fired.
Sure.
To me, it's not complicated.
Pretty simple, right? If you don't do your job, you're out the door.
Exactly.
And you guys are growing. And I'm watching other of your competitors get consolidated, eaten up, fold. Just it seems like they
Bounce around from different owners all the
Yeah,
time.
it sounds like they're not doing what Premise is doing. Like somehow you guys have
Figured it out.
Figured out that sweet spot.
Here's what I'd say.
Go ahead.
I don't wish ill upon anybody, but here's what I've been telling folks. Look, we were here when you got here, and we will be here when you leave.
I love it.
And so we were here 20 years ago. We're going to be here. And this is our life's work. We're not journeymen. Our team has done nothing but this for decades. We don't jump from company to company.
Right.
We have an owner that has given us a mandate, build a great brand, disrupt U.S. healthcare. Call us if you need us.
Love it.
So the table is set for Premise to have a significant role in disrupting U.S. healthcare, and we are really honored to be in that spot.
You should be. You guys are really doing. I mean, doesn't he sound like a union organizer?
Yeah,
Like when I organized, I would say, "Hey, listen, the union's been around 100 years. We're going to be around another 100 years. We're here before you got here. We're going to be here after you got here, and we're here to take care of you. Right? We're not going anywhere. Yeah. So
it's very personal. Yes,
it is personal. Right? Healthcare is personal. It's not like I hate to say it, but financial planning is great. And it's personal, but healthcare is really personal, right? And, I'm just going to go back to something I heard the other day, and I don't want to end with this. I was in Ohio, and they have this thing called Too Tough to Talk, and it's aimed at the building trades for people that need, mental health, but they're too tough.
Yeah.
And so, I think by Premise saying, hey, we're going to have a behavioral health specialist down the hall, when he's there, he just walk down the hall and then walk out the exit. Nobody knows where he went, right? And so those things really hit home. And I've heard, like you said, I've heard fantastic stories about members using our health centers throughout my entire jurisdiction of the MCL, which is large now and getting larger. And we hope to see more of the Premise model, if you will, follow us around.
Well, I'll tell you, it's a real honor to work for the unions, and this is some of the most exciting work we're doing.
Yeah, we're super psyched. Hey, listen, we got to go. Thank you so much for coming in, Stu. It was really cool to see you in person.
And we'll see you next Saturday up at Northbrook at the grand
bet.
opening.
I'll be there, and I'd be happy to be back in the studio at some point too.
Love to have you.
Thanks for having me.
Stu.
All right, listen, we got to take a quick break, and then we'll wrap up the show. You've been listening to Stu Clark, the CEO of Premise Health, right here on 720 WGN Workers' Mic. Welcome back, everyone, to the Workers' Mic right here on 720 WGN. I'm Ken. Sitting with me is Ed. Pretty cool show today, huh?
Yeah. It was nice to see Stu in studio.
Yeah, I love talking about stuff like this and breaking new ground and what the unions are doing and trying to get the word out of what we're doing,
Yeah.
Stop being our own best-kept secret, like you said. I want a quick shout-out to the listener this time the listener family of the week, and it is Trina, Jeff, Everett, and Oliver from Detroit. And they actually called me this morning, or texted me, I think it was, or I forget how they contacted me, but they said, hey, are you going to talk about the UAW strike? And I'm like, of course we are, So it was pretty cool, that they're like, well, hey, we buy American, we support this strike. We're here in the Midwest. We listen to your show. So shout out to those guys. Thanks for listening. And of course, obviously, we talked about at the top of the show. What are we going to finish up with, Ed?
Well, we've talked about people who support strikes, and now we're going to talk about people who don't support strikes.
How can you not support a strike?
You can cross a picket line.
Oh.
You can do struck work. So, for example, I'll just use this as an example, and this is not a hypothetical. This is a real thing that happened. And that is Drew Barrymore.
Drew Barrymore?
The little kid from E.T.
Are you joking me?
Further later known for Studio 54 antics, I think. But she has a talk show, and she had honored the strike for a while. She said they're coming back.
Right.
Said, we're not going to talk about struck work. We're not going to talk about struck movies. And the writers are just saying, well, no, it's a show that uses writers. So this you'll be doing struck work. You'll be crossing a picket line. So they started the show. And
Drew Barrymore.
And so people
I used
showed
to like
up.
her.
I know. And people showed up with pins that talked about support the writers.
Yeah.
And when they showed up for the first show that was being recorded
When
again.
you said they showed up, were you like
These were
audience
people
members?
in the audience who just wore pins, and they got thrown out of the show before it started.
For wearing a union pin.
That's exactly.
Wow. Drew Barrymore, way to union bust.
Well, I mean,
I said shame on the big three, and shame on you.
We're
Drew.
getting a double shame on this week.
Yeah,
this is a big deal.
Are you kidding me? Like, why would she do that? She's got more money than God.
Maybe not. I mean, who knows? I mean, so what she's saying
No, I
is,
think she does. She comes from a really, really famous, wealthy family. Her grandfather was like so-and-so Barrymore. And I don't know.
So-and-so Barrymore.
That's his name, yeah. That's his first name, so-and-so. Yeah. But she don't need let's put it this way. She don't need the money. You know why? She was married to Tom Green.
Yeah, Tom Green's just swimming in that skateboard money. I did used to like Tom Green.
Oh my God, I love that guy.
I think America could use him again.
Yeah, agreed.
So
she started up a show with who? Who's writing it?
I mean, I don't know. I think she's bringing back some writers, or maybe she's got non-WGA writers. I don't know.
She's not bringing back any writers. You can't cross a picket line if you're a writer, so they have to be scabs.
Well, and the industry is very upset because she was supposed to host an event for like the National Book Award.
I think that's right.
And she got bounced from that because, I think this is one of those things where what you do in these moments and the solidarity you show will be remembered.
It will define you.
Yeah, so
right?
Unfortunately, I think this will probably define her.
Isn't Bill Maher doing something?
Bill Maher is bringing back his show, and he says he's not going to be violating the strike because he's not going to use any writers. So, I mean, first off, the WGA has responded by saying that that's impossible to do his show with no writers. Yeah. But I would say if you're going to have Bill Maher just bouncing off the top of his head ideas like what's going on with Bill today with no prep for the show, I don't want to watch that show.
Well, first of all, I don't want to watch Bill Maher or whatever his name is anyway, because he seems to have made a bit of a crazy right turn. Like Dennis Miller, the guy used to be like, Mr. Progressive, whatever, and made a crazy right. I don't know. Like I think they have kind of bought into their own. Well, I don't know even what you call it, their own nonsense. But if you're going to go on, first of all, just don't go on the air, right? Stand in solidarity.
You've made it for 6 months.
Wait, Bill, do you need the money?
He must.
Seriously though, it's easy to say.
And it's pronounced Maher, Bill. Get it right.
Oh, that's a good point.
That's
you
right.
Guys spell it the same way.
I'm the one who honors picket lines.
Yeah. You're the Maher that honors picket lines.
That's right.
Well, shame on you, Drew Barrymore. I tell you what, Drew. Yeah,
Bill.
I was gonna use profanity, but I can't because we're live on the air. So shame on you, Drew Barrymore. I urge every one of our listeners to get on her social media and call her a scab, which is, by the way, what I did. And I think I got the most likes I've ever had on any of my social media ever when I called her an elite entitled scab.
Well, the people love negativity, and you got to give the people what they want.
Absolutely. So you know what? Shame on you, Drew. Shame on you, Bill.
That's all the time
Maher.
we have. We only get 3 shame on yous because we're out of time.
All right, fine, fair enough.
So thanks for sticking with us, everybody. We'll be back next week right here on 720 WGN.
See you next week.